I live in St. Albert. I'm married. I've been married for 32 years. I'm a retired teacher. My wife is a retired teacher. My mom is 86 years old, and she's in long-term care at Foyer Lacombe. And my dad is 93, and he lives with us. Before that, they were living by themselves, and we had home care going there. And home care was very unreliable. Some days they would come, some days they wouldn't come. Some days she would get her meds, other days she wouldn't get her meds. My mom has dementia, and some days she likes where she is, and other days she doesn't like where she is. I think she's been in long-term care for about 3 years, a little over 3 years. And before that, she was in the hospital. That's where the system is really broken. It doesn't allow for people to access proper care. The doctor recommended that the only thing that we could do for her would be to bring her to the hospital, get call 911, have them take her to the hospital, and abandon her there. That way they would do something for her to support her trouble that she was having. And I'm going to say she was in the hospital for about 2 months before they can find her a bed at Father Lacombe. If you don't know, or someone doesn't tell you that you should drop off your parent and abandon them there, you're going to have no access to the system. But that's the only process that really works. Because if you're trying to get them in, it's more, you know what, they're okay, they're better to be with you. For me, we were understanding what we had to do, but when you're married for over 60 years, abandoning your spouse in a hospital is very stressful. For my mom, super stressful, because now the hospital is calling us to come pick her up, and we're just not answering the phone. So she has no idea what's happening. She's abandoned. Even now with her dementia, she doesn't understand why she's where she is. I think it has to start with the funding to have people in place to make the transition smoother, whether it's getting equipment or doing paperwork. So if you have someone doing the paperwork, I found a lot of the paperwork was really hard to find. And if you make a mistake on the filling out the form, it gets sent back and you're back at square one. To me, I think a lot of people lose resources that could be available because they don't even know about it. There has to be something that monitors what's happening and can facilitate people going to the next stage when they really need to go, instead of having to circumvent the healthcare system. So I could see that a Métis organization that is geared towards looking after specific needs, making sure people know exactly what they can access, and getting them the access as quick as possible. I think they need to have full-time staff there too, because it seems like the staff turnover is huge. And I think it gets to be really hard when you're dealing with people that aren't doing well. But I think they've done everything, or everything that they can. She has a good rapport with the people that are there all the time. They check on her. But they just don't have enough resources. We have to get more funding. And I think people don't realize that if the system is broke now, in a couple of years it's going to be really bad, because the baby boomers they're coming. And I think once you get to know the system a little better, things will go smoother for you. But I also think with the cost of going into long-term care, if you don't have the financial support, you're not going to be able to afford it. It's too expensive.